Zoe. I'm the nurse working today. There's a 67-year-old female who's been brought in because of increased nausea and vomiting by her daughter. She's been having increased confusion as well. Do you guys think you could come in and see her? Okay, team, let's head in together.
Okay.
Let's do it.
Hello, ma'am. My name is Katie. I'm one of the medical students working here today. I just want to introduce you to my team.
Hi, I'm Yosef. I'm a second-year medical student.
Hi, I'm Josh. I'm a second-year medical student as well.
Hey dude, my name's Peter, second-year medical student.
Guys, looking at the patient, she seems quite unwell. Zoe, can I trouble you to start IV access on her, please? Yes, I'll start an IV and let you know when I'm done. Peter, can you hook her up to some monitors and get me a set of vitals, please?
You got it.
Thank you. And Yosef, I would like you to start a primary survey on her, please, and let me know what you find.
I'll do the primary.
Thank you. And Josh, I noticed that she had a daughter outside. If you could go and get a sample history for me, please, and report back what you find.
Yeah, absolutely. I'll get a history and get back to you.
Thank you.
Hey, Mary. You're at the hospital right now, and we're trying to help you out.
Oh, I don't feel very good.
Do you know where you are, Mary?
I don't really know.
For airway, she's speaking in complete sentences, but seems drowsy and a bit confused. For GCS, I'd give her about a 13, eyes opening to speech and confusion. Just a deep breath there. And again. And again. And again. And one more for me, Mary. Deep breath. And out. Thank you. For breathing, there's no increased work of breathing and the lungs are clear. Pete, what's the rest rate in the O2 sat?
Yeah, she is tachypnic right now. Her rest rate's 23. However, she's satting well at 94 on room air.
Mary, we're just going to take a quick look at your hands and legs, okay? For circulation, her cap refill is about 3 seconds. There's no signs of bleeding anywhere. Pete, what's her blood pressure, heart rate, and temperature?
Yeah, her blood pressure's 110/70. Her heart rate's at 120 right now, and her temp is 37.4.
And Katie, the IV is started. Thanks for the update, everyone. So just to summarize, this is a 67-year-old female who comes in with a 3-day history of feeling unwell with nausea, vomiting, and confusion. So from our primary assessment, it appears that she has altered level of consciousness, tachycardia, and volume depletion. Zoe, if you could start 1 liter of IV normal saline and keep an eye on her vitals to see if she responds to the fluid resuscitation, please. I'll start that right away. Thank you. Peter, could you check her blood glucose as part of our 6th vital sign?
Yeah, no problem.
Yosef, could you please call for an EKG for her?
Got 'em on speed dial.
Next, let's move on to our secondary assessment with the history from Josh, and then we'll do a head-to-toe examination with a repeat set of vitals. Josh, what did we find out?
So her daughter filled me in on the story. Here's her sample history. Mary's a 67-year-old lady who was getting increasingly fatigued about a week ago, and she was getting chills on and off. She started feeling nauseous about 3 days ago, and she was getting episodes of emesis. She also complained of vague, diffuse abdominal pain. She doesn't have any allergies. She's taking insulin for her type 1 diabetes. She's also taking escitalopram for her depression. Her last real meal was about 3 days ago. She's only had sips of fluids ever since. The daughter brought her in today because she was increasingly drowsy, and she's been kind of confused lately.
Thanks, Josh. Can you get started on a head-to-toe examination as part of our secondary assessment?
Absolutely. I'll start on a head-to-toe.
Perfect. Just a heads up, Mary does appear to be fluid responsive. Her heart rate's come down to 100 and her blood pressure's come up to 120 on 80. Would you like me to start a second bag once the first one is done? That sounds like a great idea, Zoe. If you could start a second bag of normal saline after the first one finishes.
Hey Katie, the blood glucose is reading at 35 right now.
Okay, thank you, Peter.
Yep.
Okay, so this could be a DKA presentation. We have a high blood glucose, nausea, vomiting, abdominal pain in a confused patient. Let's flesh this out a little bit more with our exam findings from Josh. Josh, what did you find on your head-to-toe assessment?
Yeah, Katie, on the head-to-toe, Mary's GCS is still at about a 13. Her head and neck exam is pretty unremarkable. Her heart and lung sounds were normal, no adventitious sounds, and her lungs are clear to the bases. Her abdomen is soft, but it's tender around the suprapubic region, and she does have costovertebral angle tenderness on the right side, though her cap refill has improved a little bit to 2.19953. Her legs, in general, are non-tender. There's no pitting edema that I could appreciate, and there's no bruising or rashes. Grossly, her neurological exam is normal.
Thanks, Josh.
Absolutely.
All right. So, team, we've got a 67-year-old female, type 1 diabetic with altered level of consciousness in the setting of 3 days of nausea, vomiting, with suprapubic and CVA tenderness on the right-hand side. So my differential for altered level of consciousness is the DIMS mnemonic. Let's work through that together. D is for drugs. We don't suspect that she's taken any overdoses, but was there anything abnormal, Yosef, on her ECG?
I did check the ECG, and it's just sinus tachy. She's taking escitalopram, but there's no prolongation of the QTC, and it doesn't smell like there are drugs on board.
Great, Yosef. So to continue with our DIMS mnemonic, I is for infection. She certainly could have an infection right now, particularly with her suprapubic tenderness and CVA tenderness. She could have a urologic source. So Zoe, could you get an in and out catheter on her and send a urine sample and urine culture, please? We should also get blood cultures on her and blood work.
I can order those for you, Katie.
That's perfect. Thank you, Peter.
So blood cultures times 2, urine cultures. Do you want me to add ketones and venous blood gas as well?
Please do, and then we'll also do CBC lights and a creatinine.
Sounds good.
I'll drop the blood and cultures times 2 as well as the urine and let you know when I'm finished so we can confirm which antibiotic you want.
All right, to finish off our DIMS mnemonic, M is for metabolic. We did note that she had a high blood sugar, so we think that she likely has DKA. From a structural standpoint, she is confused, but she doesn't have any focal neurologic deficits, so we think that that's unlikely. Our working diagnosis right now is DKA in the setting of urosepsis. So we're going to have to simultaneously manage both of these issues. From an infectious standpoint, we're going to send off her blood work. We'll start her on piperacillin tazobactam by IV for empiric antibiotic therapy. For her DKA, we're going to fluid resuscitate her as a priority. We're going to wait for her VBG to come back and see what her electrolytes are like before we start the insulin. Finally, she's going to need to come into the hospital, so we'll talk to the admitting services. Strong work, team.
Another life saved!
My heart is unstable.